paper is open for discussion.
So I'm going to follow up on the same as the last question that I asked before. You chose to use anti-inflammatory, well, steroid immunosuppression. Why in this case, as opposed, do you think, why they didn't in the last?
So I don't know, Dr. Chambers, but we followed Luxturna, which successfully gained FDA approval, and they too use prophylactic steroids. From the learnings in the first and second cohorts, we are confident that topical steroid drops are going to be sufficient to quell any inflammation.
It certainly remains controversial whether it's needed or not. And it would be
Absolutely.
worth people knowing whether it's needed or whether it's not.
Can you tell us the oral steroid regimen that patients were put on?
Yes, it was a 13-day oral steroid regimen that started prior to the injection of ADVM-022, continued 3 days prior, 3 days after, and then there was a taper. And it started at 60 milligrams. These inflammatory reactions that we saw did not come early on after the administration of 022, and they tended to be mild and responsive to drops. And that's what led the team to consider using only drops, although as Dr. Chambers pointed out, to be determined.
I apologize if I didn't hear this, but which cells are being transfected and are the ones that are manufacturing and secreting the aflibercept into the...
So in this case, a variety of cells are being transfected in a non-human primate. You know, there's cells that are within the retina. There's probably some ciliary body epithelial cells. Unlike with Luxturna, where you have to go to the RPE because that's where the abnormality is, it almost doesn't matter which cell, either in this study or the REGENXBIO study, actually makes the anti-VEGF therapy.
So you have specific evidence that there are multiple cells that are being transfected?
Yes, the molecular therapeutics paper that was published earlier this year has some H&E stains about the cells that are transfected following intravitreal injection of the 7M8 vector.
And where are they in the retina? Geographically, I mean, are they in the macula? Are they in the?
There's some. They're all over the retina. In my third slide, that's the GFP that we showed, where you can see ubiquitous expression of GFP after intravitreal injection. This is in contrast, and it's a great question, to intravitreal injection of AAV2, where one does not get cellular transfection. And so happy to show you the paper and talk more offline, but it's all over the retina, predominantly in the periphery, but we see it all over.
So if you were going to do subretinal injections for some of the agents that may not be as effective intravitreally, you don't need to do it posteriorly. Is that what you're saying?
That's correct. Yes, yes. For anti-VEGF therapy, absolutely.
That's an interesting observation, isn't it? Yeah.
Right.
Based on these preliminary results, would you be ready to render an opinion as to the future of intravitreal gene therapy? I mean, do you think it's something that could potentially be used in treatment-naive patients?
That's a huge, huge step, Sophia. You know, I think, you know, it's exciting, these two presentations we had with Jeff and myself. Gene therapy for AMD is here, meaning in the clinics, we see efficacy. I think if we can do it in the clinic and not have to go to the operating room, that's a clear winner. What the future holds in larger studies for both products remains to be determined.
So I had one last question, and then we'll have to move on. It seems like you excluded the neutralizing antibody to 7M8 in this.
So that's a great question, Mark. We get that all the time, and because of the time, I couldn't present the data. So all the patients were screened for neutralizing antibodies. What I can tell you is greater than 90% of patients were included in the study, so they were not screened out. So in the second and third cohort, actually more than 95% of patients met the inclusion criteria. And a follow-up comment that sometimes comes is there a correlation with the amount of inflammation that's seen and the neutralizing antibodies?
Right.
In our cohort of patients, there does not seem to be correlation, but I'm going to temper that by saying small numbers and short follow-up, but there's not an obvious correlation.
That was exactly my question. Thank you.
Thank you.